Welcome back to Fox 11 News in Depth. The crisis we mentioned in our last segment was, of course, the COVID epidemic. And it changed everything. Next thing we knew, we were all under quarantine. Suddenly, we had to leave the studio and go remote to bring the public the news and public affairs programs that were so urgently needed. Practically overnight, I was broadcasting from my living room. We interviewed guests by Skype and then by Zoom. But whatever it took, whatever changes we had to accept, we got the urgent messages out there to the public. Two of the people that helped us with that were infectious disease Dr. Suman Radhakrishna and psychotherapist Dr. Lignani. They kept us on top of both our physical and mental health during those confusing and sometimes terrifying days. Welcome to both of you, and talk to us a little bit about your memories of the pandemic, the lockdown, and how we still managed to get the important messages out to the public. And why was this show particularly important in that quest?
I was told by my manager that you were good. And Lisa Barry is the one who said, Hal is trusted. There I was speaking in long sentences. You know, we write essay answers, not two-minute sound bites. And she said this would be a good place to start. We were getting a lot of information, some of it dissociated because things were happening real time. And we needed to disseminate this information to as many people and as quickly as possible. Your show, the in-depth show, gave us a little bit more time for us to actually explain our case. And a lot of people listened to you. You're reliable. And people talked about it, you know, after they listened to what you had to say. You were also extremely supportive in terms of making me less nervous. I had never done a Skype. I had never done Zoom. So here I was learning a lot of new things. And I think you saw most of my home, you know, between my formal dining to my family room where I am right now. You've seen just about everything.
You know, that was a really complicated time. And thank you very much for those nice words. Lynn, you know, we talked about the mental health piece of this and how people were becoming sort of collectively depressed,
as well as terrified. And so many of us were grieving and frightened. And yes, we talked about the feelings. And to connect the dots back to you on that level, I think my most memorable portion of that experience was recognizing and finding a way to connect to you because you were so present and so passionate about every story you ever told. That was what really helped it be easy for us.
That means so much to me. And there we are. We see you in your home where you were living. And, you know, that this coronavirus, and it looked like a little circle with little spikes coming out of it. We tried to explain that to people. And we tried to explain what this thing was physically and how it connected to the human cell and what the implications of that were. And, Doctor, did we get an A, a B, a C? How do we do on that?
I think collectively we muddled along as population and as citizens of the world. But if you were to look at all the different sources of, you know, where people were going to get their things, I think you got an A.
Ah, thank you so much. Well, let me just get a bottom line here real quick. We only have a few seconds left. So first of all, Lynn, just tell us why television made a difference during the pandemic.
Oh, my goodness, because it was our connection to each other that we weren't allowed to have practically physically. We were allowed to continue to connect emotionally. And there were blessings that came from it, like we are doing right now, which is talking to you from remote places because we all got better at that and we're able to stay connected.
Well, you know, Dr. Radhakrishna, she's right in many ways about that. We suddenly became more community, didn't we? And in your position as an infectious disease doctor, you needed to have a megaphone out there to tell people what you knew.
I did. I think we still do. And we need to have reliable places where people can go and find out. Science is always evolving. We still haven't finished the chapter on corona. We have no idea where it's going to take us in the future. We hope that it remains a very mild virus and will just pepper out as a lot of coronaviruses are. And we are thankful for what has happened to the coronavirus. But what it also taught us was that we needed each other more than we needed science. We needed to have each other say, hang in there, you'll be okay, I'll be okay, we'll get through this.
Yeah. I sort of remember that whole feeling. And to both of you, thank you for that, and thank you for being here today. I so appreciate you, and you meant a lot to this program, and I'm glad you came back for sort of a final thought.